This video is to illustrate the glucose metabolism that happens in a normal individual versus a type 1 diabetic and a type 2 diabetic. So in a normal individual, when glucose arrives in the bloodstream, then we have insulin that arrives along with it. The insulin will dock onto the cell right here and allow the glucose to enter inside the cell. That glucose can then be used to create ATP and drive all the metabolic reactions. So this is what normally happens. Now in a type 1 diabetic, we have the glucose arrives from the meal, but there is absolutely no insulin present since the islet cells of Langerhans got destroyed from the autoimmune process, and the type 1 diabetics just absolutely do not produce any insulin, and therefore the glucose cannot make its way inside the cell. Now in type 2 diabetic, the glucose will arrive here in the bloodstream, and there is plenty of insulin that arrives also. Usually type 2 diabetics have an excess of insulin, but only a few of them can actually dock onto the cell, or if they're docking, they're not docking properly, so there's the receptors just aren't working and aren't allowing enough of the glucose to come in. So a little bit of the glucose can make it into the cell, but not all the glucose. And then of course a lot of it then will be floating around in the bloodstream. So there'll be excess glucose in the bloodstream and excess insulin in the bloodstream, but some glucose does make it here into the cell, so it can use some of it to function and to produce ATP. Now, of course, in the type 1 diabetic, what happens is the glucose cannot make it into the cell without the insulin, and therefore what it will use is it has fats right here in the cell, and so it will use the fats and burn them to create ATP and then kick out some of the products of fat metabolism into the bloodstream, which are ketones, and then you will see an elevated level of ketones in a type 1 diabetic. So you'll have, in a type 1 diabetic, you'll have elevated glucose, no insulin, and you'll have some ketones, whereas in a type 2 diabetic, you will have some elevated glucose, some elevated insulin, but some of the no ketones, because some of the glucose does make it into the cell for ATP production. Now, of course, since not a lot of glucose makes it into the cell, then what happens is it makes the person hungrier because the cells are starving because they're not getting enough of the glucose for the energy. So then they're hungry, so they'll eat more, and therefore there's more sugar that shows up and more insulin, and it keeps going on. Now, what happens to the extra glucose that is not used up, then in a lot of times in both instances that glucose will be converted to glycogen by the liver, and then if all the glycogen stores are full, it can also be converted into triglycerides.